it's really truly amazing how flexible and how versatile the specialty is.
Hello, everyone, and welcome to the Radiology Report podcast, where we are having conversations with the leaders transforming radiology today. You can find us on radiologyreportpodcast.com, Apple Podcasts, Spotify, Google, or wherever you get your podcasts. I'm your host, Daniel Arnold. Today, we are joined by Dr. Arthy Saravanan. Dr. Saravanan is a practicing breast imaging radiologist and Associate Chief Medical Officer for Recruitment at Radiology Partners, the largest physician-led and physician-owned radiology practice in the United States. She received her medical degree from Indiana University School of Medicine, Indianapolis, completed her residency in radiology at Providence Hospital in Southfield, Michigan, and Altman Mercy Hospital Northeast Ohio Medical Center in Canton, Ohio. She completed her fellowship in breast imaging at the University Health Network at the University of Toronto, Ontario, and she joined Rad Partners in 2019. Dr. Arthy Saravanan, welcome to the show.
Thank you for having me, Daniel. Absolutely my pleasure.
We are delighted to have you on the show and would love to get into everything about Radiology Partners and your role and your rise within the organization. And there's so many awesome topics to hit, but would love to first start with your background and just tell us, where'd you grow up and how did you find your way to radiology?
Yeah, absolutely. So I grew up mostly in Toronto in Canada. That's home for me. All of school and college was up in Toronto in the cold. And then I decided to move down to the US for medical school. So as you said, I was in Indiana for med school, did most of my training in the Midwest, and went back to Toronto for my fellowship in breast imaging to be close to family for the year, and realized that it was just way too cold for me. And I just did not like the aspect of bundling my kids up and putting them in car seats day in and day out for 6-7 months in the year. So I decided to move from the freezer to the frying pan and came down to Texas. So made Austin my home, and it's been my home for about 5.5 years now. Austin Radiological Association is the practice that I chose to join when I first came out of fellowship in 2017, at which point ARA decided to join, and I had the absolute privilege to join RP in 2019 as well. So that's kind of where I have been and what brings me in today.
Amazing. And it's really not nice to rub it in my face, the warm weather you have. I don't know if you can see out my window right now, but we got a fresh dusting of snow here in Utah this past evening. So cold here, covered in snow. Austin sounds really nice. What drew you to the ARA practice initially? Like, what was the scope of work in the practice as a breast imager? What were you up to?
Yeah, so when I was looking to interview, I interviewed in many different places and many different positions because really I didn't feel restricted towards one particular city or region. So I did interview pretty far and wide and interviewed in a lot of RP practices and also outside RP practices, and both academic and private practice as well. So pretty much got a good scope of how the interview process works, being kind of from the candidate side, which I like to think is not that far back, just a little over 5 years. What drew me to ARA was how stable the group was, been in the city, been in the community for more than 50 years and has been the kind of dominant imaging service provider for the Central Texas area for 50 plus years, and really had a very good name, still has a very good name in the community, very well respected by referring doctors and the patient population as well. So that's what drew me to Austin and ARA initially, was how stable the group had been and still continues to be. Also the city itself, Austin, fastest growing city, always rated kind of in the top 5 cities to live in the United States, and has really proven to be a wonderful place. Lots of young professionals here. It's really up and coming. Lots of people coming in from California and all over the place. And it's been really an awesome city. Lots of stuff to do outdoor, hiking, hill country views, all that. And I like the lake life. So I've enjoyed it so far.
Amazing. And so you get into the practice. How many breast imagers were there in the group? What was the setup like?
ARA itself is a pretty large group. So when I joined, there were right about 100 or so radiologists. We have about 125 now, so definitely growing as is most practices across the country. When I joined, there were probably about 7 or 8 breast imagers within the section, all fellowship trained. And ARA has fellowship trained radiologists in every section, and we practice all subspecialties. So pretty wide range of expertise all across the practice. And it has been great because that's, what serves us to lead to servicing the referring population and the patients. So, when I joined, that was the case. It was a very stable group, really practiced a full range and full variety of breast imaging. So all the way from screening mammography to diagnostic mammograms to all procedures, ultrasound biopsies, stereo biopsies, breast MRIs, doing preoperative needle localizations, pretty much the full gamut of breast imaging, just as you would see in an academic setting is what we did within the private practice setting, in addition to tumor boards, consulting with the referring doctors and ensuring appropriate patient care and highest quality care. So I was very much impressed by all of that, in addition to all of the efficiencies that are present within ARA. So, a lot of the navigators and paramedics and nurses here at ARA ensure that we can perform at our best in terms of radiologist efficiency, to make sure that we have all the prior imaging of patients, make sure the orders are correct, and all of the images are hung a certain way, and things like that. Hung, I still say hung because of film days, right? But yeah, so all of that really stood out and made me feel like this was a very positive place, and that's why I chose to come to the practice.
Awesome. So then how did you become the chief medical officer of recruitment? The group is acquired in 2019, I think you said. And what led you to this opportunity?
Yeah. So when I joined ARA in the initial few months, I started seeing that there was still much more work to be done, and lots of volume, lots of business to be tapped into, and that we didn't have enough manpower to do so. So being so fresh out of fellowship for myself, I kind of took things in my own hands in terms of bringing people in my own network into the practice and trying to kind of coordinate, hey, telling them my experience, talking to them about, how it has been in terms of a transition for me from training to as a practicing radiologist. And I think I was able to really relate and connect to a lot of candidates and trainees out there because of that, and was able to hire a lot of not just breast radiologists, but radiologists for different sections for the group in general. So that's kind of how I got into recruitment. It really kind of was a passion for me to talk to people, bring in people, and I really enjoyed that aspect of it. And right around the same time is when the transition to the national practice within Radiology Partners happened. And it was about the same time when Radiology Partners also offered this new opportunity for physician leaders. The office of the chief medical officer was created at the time within Radiology Partners. So essentially, it is this office, or kind of a group of people who would serve in different functions. And we all took on different roles as the associate chief medical officers for different functions. So recruitment, there's a ACMO for health policy, there's an ACMO for AI, there's an ACMO for operations. So multiple different functions is what the opportunity opened up for. And it was right around that time when I was also starting to peak within my recruitment kind of tenure, if you will, within ARA. And my group leadership, my practice president, really encouraged and motivated me to apply for this opportunity. And I was honestly a little skeptical initially because I was still very early in my career, and I felt like, this is a very experiential thing. It's also, going into the business and the management world. And for a little bit, I had somewhat of a self-doubt in terms of whether I would be qualified for this position. But I think the aspect of being able to relate to candidates and being able to see kind of really how it is like in the candidate's perspective and in their shoes really proved to be my strength. And the ability to connect to people of not just early career radiologists and trainees, but also those that are mid-career and those that are seasoned, and now being able to relate to them because of practicing within radiology for so many years, I was able to connect to different populations and different pools of people. And that's kind of what brought me to this role. And so I, went through an interview process and was very happy and delighted and to have the honor to serve in this role from 2021. So it's been really a tremendous learning opportunity for me, but it's also been a way for me to show and kind of explore some of the skills and abilities and talents that I feel like would not have been able to shine through if it's just clinical medicine practice. So truly happy and honored to have this opportunity to serve as the Associate Chief Medical Officer of Recruitment for Radiology Partners.
What an excellent story and a reminder to put your hat in the ring. I think too often we think, oh, we're not ready. And so that's a great story to hear. How do you balance today clinical versus administrative work?
Yeah, great question. I also serve as the chief of my breast imaging section here at Austin Radiological Association. So it is a balance between, there's a little bit of administrative work and management within that role as well. But I really think they go hand in hand. We're all kind of in the same group, in the same practice, trying to achieve the same thing. So I think it's definitely a team effort and an experience to be able to connect both sides and bring it to one where, my abilities and skills within ARA is able to help me within the RP world and vice versa. I do take time. I have dedicated time to do administrative work for Radiology Partners as the ACMO. And then I also have dedicated time to perform clinical responsibilities, take care of patients, and still continue to do what I really love doing. And that is also one of my passions. So it's a balance, and I think it's continuously evolving as things change. But, I think change is the only inevitable in life.
So I'll put you on the spot. You have an audience of radiologists. You've been practiced at this now for almost 2 years. So what's the elevator pitch for why a radiologist should come work for Rad Partners?
Okay, how much time do I have? Well, what I tell recruits or candidates or anyone who I'm meeting outside of Radiology Partners is, truly my experience and what I've learned and what I cherish the most being part of Rad Partners is the ability to have that flexibility and the different options, the wide variety of options that Rad Partners is able to offer given the current scale. So with 3,000 plus radiologists and with groups and practices all across the country, it's truly a practice that is able to offer the depth of opportunity that really no other practice can offer in the country. And I think that really is what makes Radiology Partners stand out. I've talked to you already about some of the leadership opportunities that RP brought to me personally at such an early stage in my career. And, really, I feel like I'm one of the examples of they really tend to bring the best out of people and physicians. And I think that's what Radiology Partners is really known for, is walking the talk, right? So it's not just the opportunity to have physician leadership and not just the opportunity to have physician leaders being involved in decisions, but it's also being the largest physician-owned and operated radiology practice, not just in the country, but in the world. And I think that makes a true, tremendous impact when it comes to those decisions of clinical expertise, but also business management and AI and health policy and all of the other functions that we talked about before. I think Rad Partners truly stands out when it comes to that. So, as a radiologist on a day-to-day, many people just want to think about, like, how am I going to come into work and go out and what is my day going to be like? And I think Rad Partners has basically anything to offer the way you want to tailor your day. So if you want to stay in and be at home and be a remote radiologist and be in your family and live in Alaska but read for Texas, you're able to do that in Rad Partners. If you want to come in on a day-to-day basis and do procedures all day long, we can make that happen. If you want a hybrid situation and do 2 days like this and 3 days like that, and perhaps do a little bit of breast imaging and a little bit of IR, we can make that happen. So there's groups across the country that make it such a versatile experience for any candidate that we're able to kind of match or fit the candidate into the perfect position that they see themselves as. And I think the ideal practice for one candidate is not the same as another. Truly, our recruitment team and our operations team strives to make it the best fit for not just the group, but also the candidate. And that's the most important thing, is how do I feel like I fit in? And I think Rad Partners does a phenomenal job in that. That's kind of some of the day-to-day and the daily thing of what it feels like to be a radiologist within RP. In addition to that, there's also several kind of outreach programs that we have done, night outs, where we invite candidates and recruits to come and to share dinner with us and some of our RP leaders and radiologists, just to learn more about what RP is about, our culture, our events. We also have several kind of booths and little events set up at conferences like ARRS and RSNA, SBI, so that people can come out and speak with us. And of course, our annual event is Transform, which is our Fellow Leadership Summit. We say Fellow Leadership Summit, but we actually invite higher level residents as well to come for a weekend out in Vegas in September to talk about RP, learn more about RP, and really get to understand what RP's mission is when it comes to transforming radiology, and how they can be a part of it in this, very rapidly changing atmosphere.
Well, that was a great elevator pitch. And, I think flexibility is something that I know is really key for this generation, as well as people in this stage of life coming out of fellowship. My own personal experience, my wife has 3 kids. My wife and I both together, right? And so, trying to make everything work is challenging, and do so in a way where you can practice the types of studies that you want to practice in the environment that you want and the location that you want. And so that unparalleled scale, being able to meet the different demands that people have, is a true competitive advantage. What are some of the most common misconceptions that you find when you're talking to, especially maybe early career recruits?
Yeah, I think one of the main things is how it's like to be a part of kind of private equity or kind of this big corporation, if you will. And that's one of the main misconceptions that I've seen. And it is, being a part of it from outside of Radiology Partners, interviewing with Radiology Partners, and then becoming a part of Radiology Partners. I've kind of seen the transition of how I felt personally, and then how I feel now and how it's been for me. And it's really been an eye-opening experience in that, Radiology Partners serves as kind of a umbrella organization for the local practice. So they're there as a national support. They take care of a lot of the back end type of things that sometimes may be a burden to local practices, such as billing and coding and, advocacy for health policy, things like that. But if you imagine an advocacy effort coming from such a large pool of radiologists, 3,000 plus radiologists, speaks volumes rather than coming from a small group of 10 or 20 radiologists. So I think that's where the power of scale comes through with Rad Partners. And I think that sometimes can be seen as a misconception in terms of, well, RP is so big, how am I going to be a part of this? But, like I was saying before, all of the opportunities that are available are very much on a local level, but there are opportunities on a national level that you can tap into and still be part of that large change and that transformation of radiology as a whole. The good thing that Rad Partners has going when it comes to a local practice is the local practices are still very, very much governed on a local level. They still have, a board, an executive committee, and different leadership within the practice that allows for local governance. And like I said, RP just takes a stance from the national perspective, being able to provide that national level resource and backup for the local groups. So, that's one of the things that when I explain how it's been from my perspective as a radiologist, kind of coming in, being an associate, and then becoming a partner within ARA and within Radiology Partners, that really, stands out. And that's been one of the big things.
On the advocacy side, one of the things that we hear all the time from different radiology leaders that we've had on the show, including we had a Congresswoman, Debbie Wasserman Schultz, on the show, who talked about how she was able to pass breast imaging legislation that's now makes mammography paid for. So hugely transformative, but needed strong advocacy to push forward. And we hear all the time that the radiology advocacy groups need to be strong and have solidarity. And so that type of scale, I think, is really important for the industry and moving it forward. When you hire, what are you looking for in a radiologist? One trend that we see is the rise of the multi-specialty radiologist, even though pretty much everyone in the US is fellowship trained. Over 85% will read outside their core specialty. Is that typical at Rad Partners, or is it more subspecialized? What can you share there?
Yeah, and as I was saying before, a lot of the opportunities within Rad Partners are very locally based, right? So what do our local groups look for, and how can we bring the most positive impact to patient care and quality of care through our local groups? So our top priority has always been safety and quality of care for patients, and we always start off with that. So, that's the most important thing when we're looking for a radiologist. Now, in addition to that, we also want to have the radiologist feel like they are a good fit within the organization itself, both on a local level as well as a national level. So when it comes to the community of RP and bringing people together, we want to have radiologists that have a similar mindset in terms of that culture, right? Like believing in equality, believing in inclusivity, making sure, of course, number one, patient care and safety are the top priority, but also being a part of the mission of transforming radiology and how important it is to support the mission of investing in AI, for instance, and being part of that transformational process where we are seeing a lot of changes and being kind of a front runner and ambassador for the rest of the radiology world, if you will. So, that's always been some of the things that we look for in radiologists. The multi-specialty radiologist, yes, it's kind of a lot that comes in waves, right? So sometimes I think many years ago, decades ago, there were not any fellowships at all. So all radiologists were general radiologists, and as we kind of progressed, people started to choose areas of interest, and we're seeing more of that now. But I think just to suit what's happened over the last few years in terms of the pandemic and more people starting to appreciate flexible, remote, and hybrid opportunities, I think we're starting to see some changes to that. But it always ebbs and flows, so it's interesting to see how the pendulum swings back and forth. And I think RP is at the forefront of also accepting and being a part of this change. We're never kind of in a stagnant or static place. We're always moving things around and always in flux and always allowing for a dynamic mindset such that we can incorporate these changes within the market as well.
Awesome. Switching gears a bit, this month is National Women's History Month. More than 50% of med students are women, but the number of women that go into radiology is around the mid to high 20% range. My own personal experience, sorry, Taylor, I think she's a common talking point on the show, but when she was at Penn for residency, there were 11 men and she was the lone female in her residency program, and that was just a few years ago. So what's going on? Why do you think this is? How do we attract more women to the specialty?
Yes, I'm so glad you asked. Thank you for the question. Women in radiology has been a very strong passion of mine as well. And, as you can tell, I'm a very strong advocate for women in medicine. I think, I've been trying to read articles and literature, just trying to understand the same question you asked. Why is it that so few women choose radiology? Because from my perspective, I feel like radiology is such a flexible, lifestyle-friendly opportunity for women. I had both my children during residency. I felt very well supported, still felt like I could do my training and was able to graduate in time and still continue without any breaks in my career. And I feel to this day that it's been a tremendous opportunity for me to pursue this field, and particularly breast imaging, where I'm still able to have that patient interaction, that contact, have the fulfillment of doing procedures, but also have that bedside manner and the kind of nourishing self. And I think that might be one of the things that comes out in terms of why less or fewer women choose radiology. It's because of that common kind of preconceived notion that radiologists are essentially in a dark room and don't have any patient interaction, and there's not an opportunity for the kind of nurturing self that some women really strive to want to do as physicians. And the other thing is also the concept of this whole spatial and kind of 3D abstract thinking, which I think for me, it doesn't come intuitively. So I do have to kind of think about it more, put more effort into transforming this kind of 2D image that I'm seeing on the screen into a person, and, trying to visualize how this mass, for example, in a mammogram looks in the breast when I'm seeing the woman. And, it is a little bit of a challenge when it comes to that. So there's also been some articles that have been published about how it is more intuitive for males to kind of process that in terms of that kind of spatial thinking. So I think it's a challenge, but I love challenges, and that's kind of why I chose radiology. But I've also learned very much that it is definitely a field that brings me so much fulfillment and satisfaction that I don't feel like I get up and I'm going to work. I feel like I'm getting up and getting paid to do what I love to do. So I really hope to spread the message amongst women, and I really hope that more women can feel the way I do about being able to practice in a field that brings so much fulfillment to life.
It's such an interesting topic. It could go on its own podcast. Have they done any surveys as to sort of med students, why they choose what they do? If not, they should, because some of the things that you were hitting on around maybe these perceived notions of what the job is versus the reality. And there's no better job for someone who is trying to balance motherhood and a career, where you can flex up and down depending on where you are in your stage of life. Maybe when your kids are young, you want to dial it back, and then your kids are on more stable footing and you want to dial it up, and you want to be able to work from home sometimes. I mean, there's really not very many fields like it for, balancing being a mother and being a career position. I wonder, the thing you said about the spatial awareness had me thinking a little bit about engineering. And I wonder if it's something, because I imagine engineering schools also skew very heavily male. I know that from my own experience studying engineering. And a lot of radiologists studied engineering in college. And so maybe there's something too around this. It is more technical and engineering and software. And there's even more early exposure. It's like college getting people into the right majors. Anyway, such an
Yeah, no,
important problem.
so true. I completely agree with all the points you brought up, especially when it comes to being able to flex up and down based on where you are in your life and how you see your career changing as parenthood and other responsibilities also come into play. So honestly, I can't think of any other medical specialty where you can actually work from home and
Yeah.
where you can choose to go and do procedures all day long if you want, but really on a day, if you really want to work remotely, you can. So it's really, truly amazing how flexible and how versatile the specialty is. Yeah, when it comes to the whole kind of spatial learning software, it's been a really interesting topic for me as well. And I've been trying to identify why is it that more women are shying away from that? Is it the physics, or is it the more kind of abstract conceptual thinking? Or is it just that we don't want to sit around dark rooms and talk about football all day long? I don't know. Although
Could
I've
be.
started to really enjoy that now. So being in the physical.
Yeah, well, clearly a lot of education is required. I think one thing that is an encouraging sign, at least, is overall interest in the field is up considerably. 5 years ago, when Taylor did the match, it was like 100 spots went unfilled. This year, I think it was the most competitive specialty, or certainly among the top few. So, as you mentioned, cyclical nature of things, radiology is sort of in demand right now as far as specialties go, and maybe with just more volume of people,
Right.
hopefully that will give more opportunities for women.
Yeah, absolutely.
So,
And, just wanted to add something in there. Within Rad Partners itself, we also have a belonging committee. And, it specifically addresses these issues that we've discussed, in terms of women in medicine, the diversity, the inclusivity. And I think RP does a great job, not just from the local level, but really comes from top down, where our leadership, our CEO, our president, our chief operating officer, all very truly and passionately believe in having the voices of people that are less well represented out there. And I think this Office of the Chief Medical Officer is one of those aspects, but there's also physician leadership across the practice, right? So we have physician leaders that are national subspecialty leads that are making decisions about clinical strategy within RP. And there's several hundred physicians that are involved in leadership level within RP that are truly impacting change, especially when it comes to this culture, support, inclusivity, and diversity. So it's a true mission for RP as well.
awesome. So you mentioned one of the reasons that you were drawn to ARA was the investment level in technology and just how advanced the sites were. Tell us a little bit about what's coming. What are you excited about? You're still very much a practicing clinician. You're leading the practice as well. So these are top of mind clinical technology decisions for you. What's coming?
Yeah, there's a lot of exciting stuff. And this is the thing with radiology is there's always something new in terms of technological advances that are coming to radiology. And I think AI is definitely one of the things that is in the forefront, not just for breast imaging, but for general radiology, diagnostic radiology overall. I think within ARA, we're starting to look at different service lines that we haven't offered previously, such as contrast enhanced mammography, such as using kind of different AI softwares, piloting some of those to see if they can help enhance the efficiencies of the radiologists. And this is not just within ARA, but I think RP is really taking on a huge role in the being the forefront and the leaders of AI within the kind of the market and the industry right now. So there's several software that we've implemented within RP. We've created some, and we're also partnering with groups outside for AI specifically to look at how we can improve radiologists' efficiencies. And it's not just to make radiologists work harder. It's actually to make it easier for the radiologist to work, because AI software should be designed such that radiologists are directly contributing to how the software gets developed and how it makes our lives easier to read cases and to make sure we're doing the most accurate and best quality care when we do so. So I think, what's up and coming is how can radiologists be more efficient in what we're currently doing and also improve quality and patient care at the same time.
Awesome. Any advice on building a career? I think two things became clear in this conversation, for me at least. One is that you've had a blossoming career, but two is how much you enjoy your career. The passion really shines through. So what advice do you have for early radiologists just getting started?
Yeah, I absolutely love what I do. And yes, thank you for reiterating that. For me, I love it so much that I actually changed the color of my car to pink for breast cancer awareness. So it's been truly phenomenal for me, life-changing in many ways. And I think the main thing I would say to people that are just coming out of medical school or even residency is to have an open mind, right? So if you go in kind of with a preconceived notion of anything, you're more likely biased in a negative sense to not accept that or not see some of the positives. So whatever the case may be, I think, just to have an open mind, ready to explore and ready to kind of take on whatever information you can get and just really be a sponge and soak up as much information as you possibly can and make an informed decision after that. Do I like academics better? Hey, that's great. We definitely need a lot of faculty. We need people to teach and to grow the next round of radiologists. Or do you like private practice? Do you like being a part of a large organization and have opportunities for leadership and be part of committees and, still practice high quality radiology? RP is the place for you. So, there's very different opportunities and very differing opportunities that you can really pursue in your career and really tailor the way you want to practice in the future, just as long as you're open to opportunities. The one other thing that I also get from trainees is kind of the sense of the fear of the unknown, right? Like, what am I really walking into? What does it actually mean to be a radiologist in the current climate and the atmosphere? And sometimes it's hard to know because you really haven't lived in those shoes. So it's okay to try some things out, and it's okay to come out and just say, I want to try this job and I want to see if this is going to work out, and maybe take on positions as independent contractors perhaps and test the waters before you commit. And there's nothing wrong with that. So I think there's plenty of opportunity out there. If there's any interest in RP opportunities, we have a mentorship program that we help support trainees and residents and fellows, where we connect them with an RP radiologist and help them be a guide throughout their career and their early interviewing process as well. So I'm happy to share more about that if anyone's interested.
Dr. Saravanan, thank you so much.
Absolutely, my pleasure. Thank you so much for having me.
Thanks for listening to this episode of the Radiology Report podcast. Be sure to visit us at the radiologyreportpodcast.com or subscribe to the show wherever you get your podcasts to join us for our next episode. We are always looking for great guests. If you have someone you'd like to hear on the show, please get in touch with us online.